Hello everyone. So in this video we are discuss about the classification of joints, and this question is important in anatomy. Now basically we have four classification, and in that different sub classification is present. So total four classification. First is structural classification, second is functional classification, third is regional classification, and fourth is according to the number of articulating bones. So this is fourth classification. So total four classification of the joints majorly. Now we discuss one by one. In that, first is structural classification. In that, sub classification is fibrous joints. Then second is cartilaginous joints. In that also two is present. Okay, then third is synovial joints. In that also seventh subclassification is present. Then second is functional classification, that is synarthrosis, amphiarthrosis and diarthrosis. Third is regional classification. In that subtype are skull type, vertebral type and limb type. And fourth one is according to number of articulating bones. So in that simple, compound and complex. So these are the sub classification of the joints. Now we discuss one by one. So first one is structural joints. In that, first is fibrous joints, and in fibrous joint also three sub classification. That first is sutures, second is syndesmosis and third is gomphosis. Now basically what is fibrous joints? So the bones are joined by fibrous tissue, that known as fibrous joint, which is immovable or slightly movable joint. So three subtypes. First is sutures. Sutures means what? कि immovable होय. जे पण joint છે that is immovable. So the example is skull bone. Then second type is syndesmosis. Syndesmosis, in that example is tibiofibular joint, the joint between tibia and fibula bone, that is under syndesmosis fibrous joint. And third is gomphosis. Gomphosis એટલે શું કે socket type હોય, socket and any cavity હોય. So the example is tooth and socket. So this is about the fibrous joints. Now second structural classification ma second type, that is cartilaginous joints. So cartilaginous joints, in that we have two classification again. So primary cartilaginous joint and secondary cartilaginous joint. So primary cartilaginous joint, which is immovable, seen between epiphysis and diaphysis of long bone. Okay, epiphysis and diaphysis जो હોય બોનના એની વચ્ચે જે જોઈન્ટ જોવા મળે, that is primary cartilaginous joint અને immovable હશે. The example is costochondral joints. Okay, એટલે કે ribs વચ્ચે. So costochondral joints, that is about the primary cartilaginous joint. You have to remember just examples and one point of that joint, that is enough. Second is secondary cartilaginous joints, that covered by thin layer of hyaline cartilage. What is cartilage? We discussed in for previous video. Okay, cartilage types and hyaline cartilage શું છે, that also we discussed. So it is covered by thin layer of hyaline cartilage, and these joints are permanent. Okay, the example is pubic symphysis. Between pubis bone, the pubic symphysis is the example of secondary cartilaginous. Okay, so now another third type from the structural classification, that is synovial joints, and which question is important for 3 or 5 marks. It is very important. Okay, synovial joints. So you can write it is the subtype of the structural classification. Okay, so what is synovial joints? So most mobile type of joints. Okay, કે એની અંદર બધા જ movement allow કરશે, like flexion, extension, abduction, adduction, all that. So it is most mobile type of joint. First is in a subclassification. So first is plain synovial joints. So articular surface which is flat and permit gliding movements. जो gliding movements થતી હોય એ allow કરશે, અને જે surface હશે articulating surface joint વચ્ચેની, that is flat. So that's why it is known as plain synovial joints. Example is intercarpal joints એટલે કે કાર્પલ વચ્ચે, intertarsal joints એટલે કે લેગમાં between two tarsals the joint is present, that known as intertarsal joints. Then intermetacarpal એટલે કે handના metacarpals વચ્ચે, and intermetatarsal joint. So these are the examples of plain synovial joints. Next subtype of the synovial joint, that is hinge joint. હિંજ મીન્સ કે ધજાગરા જેવું ગુજરાતીમાં કહેવાય. ઓકે, સો મિજાગરા જેવું. ઓકે, સો હિંજ જોઈન્ટ મીન્સ આર્ટિક્યુલર સરફેસ પુલી શેપ. ઓકે, પુલી શેપ એટલે કે જે ગરગડી શેપ હોય, કૂવામાંથી આપણે પાણી કાઢીએ એ શેપની. સો ધેર આર સ્ટ્રોંગ કોલેટરલ લિગામેન્ટ્સ ઇન hinge joints. Okay, so the example is elbow joint, okay, and ankle joint, and the interphalangeal joint એટલે કે between the phalanges joint is present, that is interphalangeal joint. So these are the example of hinge joint, which is allow the flexion and extension moment. Next is pivot joint, third. So movements permit in one plane around vertical axis and transverse plane. Okay, any વચ્ચે one movement allow કરશે. So example is superior and inferior radioulnar joint and atlantoaxial joint એટલે કે atlant અને axial બોનની વચ્ચે cervicalના. So that joint is example of pivot joint, superior inferior radioulnar joint and atlantoaxial joint, which allow only the one axis movement, that is vertical axis. Fourth type in synovial joint, that is condylar joint. So articular surface include two distinct condyles. Condyles હોય એટલે કે concave અને convex જેવું. Concave means this shape અને convex એટલે આ રીતે. તો આ જે શેપ છે એની અંદર આ શેપ બેસી જાય એ રીતનું જોઈન્ટ હશે, that is condyle joints. Example knee joint and TM joint, that is temporomandibular joint of the jaw. Okay, then fifth type of synovial joint, that is ellipsoid joint. It allow the free movement. Articular surface include oval, concave and convex surface, બધી surface ની articulating surface હશે. Movement, flexion, extension, abduction, adduction, circumduction બધી allow કરશે. The example is wrist joint and metacarpal phalangeal joint, that is MCP. Next is sixth type of synovial joint, that is saddle joint. Okay, articular surface concave or convex, movements similar to ellipsoid joint એટલે કે બધી movement allow કરશે આ પણ. Example is different, just first carpo metacarpal joint એટલે કે થંબનો. Okay, હેન્ડના થંબનો first carpo metacarpal joint. Second example sternoclavicular joint એટલે કે sternum bone અને clavicle વચ્ચે, and joint between femur and patella in leg. So these are the example of saddle joint. સેવન્થ સાઇનોવિયલ જોઈન્ટનો ટાઈપ છે, દેટ ઇઝ બોલ એન્ડ સોકેટ ટાઈપ ઓફ જોઈન્ટ. એટલે કે બોલ હોય અને સોકેટ હોય તો એની અંદર ફિટ થઈ જાય. સો એક્ઝામ્પલ ઇઝ શોલ્ડર જોઈન્ટ એન્ડ હિપ જોઈન્ટ. આર્ટિક્યુલર સરફેસ ઇન્ક્લુડ ગ્લોબ્યુલર હેડ એન્ડ કપ શેપ સોકેટ. સી ધીસ ઇઝ શોલ્ડર જોઈન્ટ, તો કપ શેપ સોકેટ જેવું હોય અને યુમરસનું હેડ છે તો એનું ફિટ થઈ ગયું. અધર એક્ઝામ્પલ દેટ ઇઝ ફીમર હેડ વિચ ઇઝ ફિટેડ ઇન એસિટાબ્યુલમ. સો દેટ ઇઝ અબાઉટ હિપ જોઈન્ટ. સો ધીઝ આર ધી એક્ઝામ્પલ ઓફ ધી સાઇનોવિયલ જોઈન્ટ. Now the second classification is functional classification. અત્યાર સુધી આપણે જોયું તે સ્ટ્રક્ચરલ ક્લાસિફિકેશન જોયા અને એના સબ ટાઈપ જોયા. એમાં ફાઇબ્રસ જોયું, કાર્ટિલેજિનસ જોયું અને સાઇનોવિયલ જોયું. નેક્સ્ટ ઇઝ ફંક્શનલ ક્લાસિફિકેશન. ઇન ધેટ વી હેવ થ્રી: synarthrosis, amphiarthrosis and diarthrosis. Synarthrosis means which is immovable. Example is sutures. Second is amphiarthrosis, that is slightly movable. Example is secondary cartilaginous joint and pubic symphysis. And third is diarthrosis, which is freely movable like synovial joint એટલે કે બધી જ movement allow કરશે. Third classification, that is regional classification. In that skull type, vertebral type and limb type. ત્રણ classification છે. So skull type means immovable, vertebral type means slight movable, and limb type એટલે કે આપણે limb જેવું upper limb and lower limb, which is freely movable. Okay, and last classification of the joint, that is according to the number of articulating bones. So first is simple joint, compound joint and complex joint. Simple means ekdam simple. Okay, કે only two bones articulate, so that is known as simple joint. કે બે બોન વચ્ચે articulation હશે, that is simple joint. Example is interphalangeal joints. Second is compound joint એટલે કે more than two bones articulate within the one capsule. So example is elbow joint and wrist joint. And third is complex joint. So when joint cavity divided by an intra-articular disc, એટલે કે cavity હશે intra-articular disc હશે એટલે કે complex type થયું, so that's why it is known as complex joint. An example is SC એટલે કે sternoclavicular joint, sternum અને clavicle bone વચ્ચે, અને TM joint, that is temporomandibular joint. So this is all about the classification of the joints. Thank you.